This is Chapter 5, Recording 1, talking about the human body. This is still within the preparatory section. We'll be talking about anatomy and physiology, as well as some pathophysiology. You need to have at least a basic understanding of anatomy within this field when we're trying to decipher what's wrong with our patient, trying to figure out what wounds they could possibly have or injuries they could possibly have based on what happened to them. You kind of need to know where what is in the body and then how it works. You should also know the medical terms, because you'll be talking to other medical professionals and we all kind of speak the same language, and it's weird. I'm not going to lie to you, it's weird. But you also need to understand basic language so that you can talk to your patients and explain what's going on with them. Topographic anatomy is how we orient ourselves in the body. You have superficial landmarks that are just under the surface of the skin that serve as guides. They kind of tell you what's going to be underneath of them, also known as deep in the body. This applies to a person that is standing in anatomical position. So every time we're going to reference our patient, we need to mentally put them in anatomical position, which means they're going to be standing, facing you, feet generally about shoulder width apart, arms out to the side, palms facing forward. There are planes of the body. These are imaginary straight lines that divide the body into different sections. So think of having a big sheet of glass. If you slide it in the top of the head, coming down, having it horizontal, the line itself being horizontal, you're going to cut the body into the front and back portions. If you take that and lay it down and then come through the body, that's transverse, also known as axial, and it cuts the body into top and bottom portions. Then if you take it and turn it so that you're going front to back in the body and bring it down, you'll end up cutting the body into the left and right portions, which is the sagittal or lateral plane. Here you can see the representation on the screen. The coronal plane, also known as frontal, is the purple one, and it's coming down through her shoulders from the top of her head, cutting the body into the front and back portion. You have the green transverse plane, which is running straight through her abdomen, cutting her into top and bottom halves. And then you have the sagittal blue plane that is cutting her body into the left and right halves. We only have one line that cuts the body into relatively equal portions. That is the mid-sagittal line. It runs directly down the center of the body, starting at the top of the head and then running all the way down. And if you were to reference that line, we also call that the midline as well. Directional terms are very important when you're discussing an injury location or where pain is radiating within the body. We typically have a reference point first, and then we describe the injury in relation to that reference point. So anterior or ventral is going to be towards the front of the body. Posterior or dorsal is towards the back of the body. In order to remember what dorsal and ventral are, just remember that dorsal is on the back because all large ocean mammals have a dorsal fin that are on their back. Left and right, when you're discussing left and right, make sure that you're talking about the patient's left or right. So you'll have to place them in that anatomical position, which typically, if you're facing your patient, is going to be the mirror of yours, but make sure you reference the patient. Superior is closer to the head or on top of. Inferior is closer to the feet or underneath of. Here's kind of a representation. There's a couple of other terms you need to know. Proximal is closer to the point of attachment, typically going to be closer in towards the trunk of the body. Distal is further away from the point of the attachment. Lateral is away from the midline. Medial is toward the midline. Superficial is going to be closer to the surface of the skin, where deep is going to be further away from the surface of the skin as we're talking about the internal body. We also have movement terms. Flexion is the bending of a joint. So you take a joint and it has a certain angle to it. Laying flat, your elbow is at 180. If you were to bring that hand up towards your shoulder, you're going to be decreasing the angle of that joint. That's flexion. Extension, if you lay your arm back open, you're going to be increasing that angle over that joint. So that's extension. Adduction is moving toward the inline. So if you put your arm out to your side and then bring your hand to your chest, that's adduction. You're bringing it into the body toward the midline. Now go ahead and take your hand and stretch it back out to anatomical position. That's adduction. You're moving away from the midline. Some more representations here in pictures. Flexion is pretty easy. Flexing your muscles, you tend to shorten that muscle, which shortens the joint, reduces the angle. Extension is the opposite. Adduction is toward the body. Abduction is up away. Other directional terms, keep in mind that most of your structures are going to be bilateral, so they're on both sides of the body, both sides of the midline. You have two eyes, you have two ears, etc. So make sure that when you're referencing ears, you reference which ear, since you have two of them. The abdomen is divided into four main quadrants in order to communicate position. You've got the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. You should know which organs sit within which quadrant. That's how you're going to decipher what's going on. You'll assess all four quadrants, and depending on where the pain is or where you feel the abnormality, kind of tells you what organ has been affected. The right upper quadrant is significant with your liver, your gallbladder, portion of the stomach, and then intestines. Left upper quadrant has some of the liver, but the stomach is up there, the pancreas is up there. Then in the right lower quadrant, mostly intestine, but you do have one very important structure down there, which is the appendix. Left lower quadrant, not super exciting, just intestine. You do have reproductive organs of the female system. Ovaries are going to be in each. And then that midline is going to divide the bladder and uterus. Anatomic positions for how the body is seated or laying. Prone is face down. Supine is face up. A ridiculous way to remember this is that if you're holding a bowl of soup, your palm is going to be face up because you're actually holding that bowl. If you have it prone, you're going to spill the soup. I know it's ridiculous, but it works. The shock position, actually called the modified Trendelenburg position. We don't use this as often as we used to, but we still teach you guys what it is. Your Fowler's position is sitting up. There's two different ways to sit in a Fowler. You can do a full Fowler, which the patient's hips are at 90 degrees. Typically, if your patient is having a hard time breathing, they're going to put themselves in a Fowler's position. Semi-Fowler's is leaned back slightly, so hips are about at a 45. This is going to be most comfortable for transporting the majority of our patients. They're going to want to sit back a little bit. The recovery position is your patient laying on their side, top leg is bent, bottom leg is straight, and then their head is kind of resting on their arm. This is for semi-conscious to unconscious patients that have no trauma suspected. That way, if they throw up, they're not laying on their back and they end up choking on it or aspirating, which means to breathe it into your lungs. And they're not laying on their face, which could compromise their airway. This is the safest position for them. The first system we'll go to is the skeletal system. This is what gives us our structure, what makes us be able to stand upright like human beings are supposed to. It also protects all of your vital organs to some degree. Your skeleton contains bones, which build the structure of the skeleton. Ligaments connect bones to each other. Tendons connect muscles to bone. And then cartilage is a relatively flexible material that protects your joints. It covers the ends of bones so that the bones in your joints don't rub together, because that would cause an awful lot of pain. You have two different portions to your skeleton. You have the axial skeleton and the appendicular skeleton. Your axial skeleton is basically the foundation on which your arms and legs are attached to. So your thorax, your skull, and then your spinal column. Your skull, you've got your cranium, which is kind of the back and upper part of your skull, is made up of 4 major bones. And the reason that you have the cranium, its job is to protect the brain. You also have a hole in the bottom of your skull. You can see that represented by the gray to black area within the blue bone on that right picture. It's called the foramen magnum. This is the opening that's at your base of your skull, which allows your spinal cord to conjoin with your brain. The posterior portion of the cranium, that blue, is called the occipital bone, also known as the occiput. You have 2 lateral bones on either side of your head, which are called your temporal bones or your temporal region. Your temples are located here. You've got between the temporal and the occiput, that's the parietal bone. And then your forehead is created by your frontal bone. Your facial bones, the majority of your face is made up of 14 bones. You have your maxilla, which is the upper part of your jaw. You have your zygomas, which make up your cheeks. You have your mandible, which is the lower movable portion of your jaw, so it has your chin. And then your orbits or your eye sockets are made up of several different bones, but we just kind of refer to them as your orbits or eye sockets at this level of medical training. But they are made up of your zygomas, your maxilla, frontal bones of the cranium, as well as a couple of others in there. The nose itself has very short bones that kind of make up the bridge of the nose. Those are called your nasal bones. If you feel down your nose, about 1/3 of the way down, you'll feel kind of some bumps. That's where the nasal bones end. The rest of it is just cartilage. Your spinal column is made up of 33 bones called vertebrae, and it's divided into 5 different sections. The top section is the cervical vertebrae. There are 7 of them, and they are so named for that area. So you have C1 through C7. The next section is your thoracic vertebrae. It's kind of the middle and upper back. There are 12 thoracic vertebrae, so they are so named T1 through T12. Your low back is the lumbar vertebrae. There are 5 of them, named L1 through L5. You have 5 fused vertebrae in your sacrum, or the back portion of your pelvis. And then you have your coccyx, which has 4 bones, and that is your tailbone. Easy way to remember is think of general meal times. You eat breakfast at 7, there's 7 cervical. You eat lunch around noon or 12. There are 12 thoracic. And then some people eat dinner around 5. There are 5 lumbar vertebrae. Your thorax is formed by your 12 thoracic vertebrae and then 12 pairs of ribs. You can see that your ribs can join into that central bone there known as the sternum, which has 3 different parts. You've got the manubrium on the top, the body in the middle, and the xiphoid process at the bottom. Your ribs, except for the last 2, are conjoined with that sternum. Your last 2 sets are known as floating ribs. The purpose of your rib cage is to protect your heart, lungs, your esophagus, and then some of your great vessels. And this is recording 1.